Burns are wounds caused by heat, radiation, electricity, or chemicals. They are a leading cause of injury in the home, especially for young children and elderly people, and at these ages, burn injuries are very serious. The skin protects the body from bacteria, helps regulate body temperature, and retains fluid in the body. Damaged skin can't perform these vital tasks. A burn is described as superficial, where the top layer is damaged, making it red and painful, a partial thickness burn, where both layers of skin are damaged and blisters and swelling can happen, and a full thickness burn, where the burn extends through the skin into the fat and muscle beneath. It's not just the depth of a burn that makes it serious, though. The size of the burn and the location is critical as well. A superficial burn over most of the body is as likely to produce serious shock as a small, full-thickness burn on a limb. You should seek medical attention for any burn to someone under 2 or elderly. These age groups are at higher risk of shock. That produces breathing problems. Inhalation injuries can damage the airway. That happens at a joint, the knee or the elbow, for example. These will not heal well. Any electrical or chemical burn should be seen by medical aid. There may be complications. Heat burns, also called thermal burns, are the most familiar kind of burns. Common heat sources include open flames and hot objects. A scald is a heat burn caused by hot liquid or steam. Heat burns can also be caused by friction. First aid for heat burns involves cooling the burn right away. Immerse it in cool water if possible, pour cool water on the area, or cover it with a clean, wet cloth. Cool the burn until the pain has lessened. This will reduce the temperature of the burned area and reduce tissue damage, swelling, blistering, and relieve the pain. Be careful cooling large area burns. You may cause hypothermia. Loosen or remove anything on the burned area that is tight. This means jewelry and tight clothing. Do this as soon as you can, before the injury swells. Don't remove anything that is stuck onto the burn. When the pain has lessened, loosely cover the burn with a clean, lint-free dressing. If the area is large, use a sheet. Secure the dressing with tape, making sure there is no tape on the burned area. Give ongoing casualty care, including arranging for medical help, first aid for shock, and monitoring the casualty. Chemical burns are often serious because the chemicals continue to burn as long as they remain on the skin. Examples of industrial chemicals that can burn include acids, alkalis, and phosphorus. Common chemicals kept in the home that can burn include paint stripper, oven cleaner, drain cleaner, and rust remover. First aid for chemical burns means removing the chemical from the body by flushing the area with large amounts of cool water. Don't delay flushing to remove clothing. If the chemical is a dry powder, quickly brush off any loose chemical with a cloth before flushing. Continue flushing the area with water for 15 to 20 minutes. When the area has been flushed, loosely cover the burn with a clean, lint-free, preferably sterile dressing. Give ongoing casualty care, including arranging for medical help. If the casualty complains that the burning sensation increases, flush the area again for at least 10 minutes. Electrical burns result from contact with an electric current. Although it is heat that causes these burns, electrical burns are considered separately because of the complications caused by the electricity. An electrical current going through the body can cause the heart to stop. Also, an electric shock can violently throw the casualty. Head and spinal injuries, fractures or dislocations may be present. There is also the danger of electrical injury to the first aider. Electrical burns can be either flash burns or contact burns. A flash burn results when electricity arcs from the electric source to the casualty, producing intense heat for a very short time. This heat causes flash burn, which can be a very deep third-degree burn. In some cases, the tissue is completely burned away, leaving a hole. The electricity does not travel through the body in flash burn, so tissue damage inside the body is usually not severe. In a contact burn, electricity travels through the body. The body conducts the electricity from one point to another, and the electricity travels along a path through the body. The body may be burned at both the point where the electricity entered the body and where it exited. There may also be severe tissue damage inside the body, along the path the electricity followed. Perform a scene survey. Make sure there is no further danger from electricity. If you are not sure, don't put yourself in danger. Call the power company or other officials to make the scene safe. Only turn electricity off at the source. Never try to cut or move live wires. If high voltages are involved, all you can do is keep others out of the area until the power is shut off. Does it look like the casualty was thrown? If so, suspect a head or spinal injury. Do a primary survey and give first aid for life-threatening injuries. Do a head-to-toe exam to locate burns and any fractures, dislocations, etc. Look for both entry and exit burns. Give first aid for the burns by covering them with clean, dry dressings. Tape these in place, making sure the tape doesn't touch damaged skin. Give first aid for any fractures or dislocations. Give ongoing casualty care, including getting medical help, giving first aid for shock, and monitoring the casualty. Radiation burns are most commonly seen in the form of sunburn, where the sun is the source of radiant energy. Other types of radiant energy that can cause burns include X-rays, arc welder's flash, and radiation from radioactive material. First aid for sunburn starts with getting out of the sun. Gently sponge the area with cool water or cover with a wet towel to relieve the pain. Repeat this step as needed to relieve pain. Pat the skin dry. For minor sunburn, there are medicated sunburn ointments and lotions available. Apply the lotion according to directions on the package. Protect burned areas from further exposure to the sun. Don't break any blisters. Doing so may promote infection. If large areas of the skin begin to blister or swelling is evident, get medical help.